Welcome to Axon Integrative Health. Congratulations on taking the next step in your health and performance journey.
Thank you for trusting us with your health, and thank you for helping us reach our mission of changing the paradigm of healthcare. We're going to walk through what it looks like to be a patient here at Axon, our processes, and how things are going to look for you.
We have 3 core principles of care here at Axon.
We apply these core principles to any patient walking in our doors, dealing with brain, body, mind, condition, injuries, concerns, or just looking for that better edge of performance.
Number 1 is modulating inflammation.
We really emphasize the modulating aspect of this. Not all inflammation is bad, and making sure that we have inflammation where we should and also not where we shouldn't. That is a fine line to play, and playing around or modulating inflammation is highly important to making sure that our second core principle is able to get done, as well as making sure that your whole system operates properly.
Number 2 is improving cellular health.
And what we mean by that is all cells of the body, ranging from the neurons that are in your brain, the muscle cells that are in our body, the cardiac cells, your gut cells, and your GI system, and how all of these cells communicate with each other, send signals to and from, and get nutrients and expel waste products from them.
Our third core principle here at Axon is enhancing neuroplasticity.
This is the core of brain health, is improving and having your nervous system adapt and change to the environment that's placed in front of it. We can't really encourage that neuroplasticity until inflammation has been modulated, until those cells can make proper connections, communications, and fuel themselves properly. And then the brain is able to come in and make these lasting changes occur and happen long term. And neuroplasticity is what fires together, wires together. And when we make that rewiring, it is permanent until something comes along to undo that. You don't revert back. So the changes that we make here at Axon are lasting. They are not addressing or chasing symptoms. They are addressing your contributing factors and the issues you have at hand, and your system and your symptoms and the systemic changes that happen because of all of them. So we just went over our 3 core principles of care here at Axon. This is our process. This is how you move through, how we identify what's best for you and what you're dealing with, whether that's the condition, the injury, the infection, the concern, if you're here for performance or if you're here for generalized wellness and optimization. These are the steps that we go through as a patient.
Step 1, evaluate and assess.
You've likely already gone through this. This is our evaluation process. This is that 1 or 2 hour eval that we kick things off with.
Step 2, identify, reveal, and uncover.
This is our diagnostic phase. This is likely the part that you're in right now. This is our discovery phase. This is how we identify further specific data points and details of the functionality of these systems that we've identified as maybe weaknesses, or as I like to call them, areas of opportunities. By having this data, we're able to go through an in-depth analysis and review of findings of what exactly is limiting your system and giving you this negative experience or symptoms that you have on a day-to-day basis. At the end of this, we have our review of findings. We talk to you about what this means, how this applies to you, and then we modulate or delineate the appropriate treatment plans from what was proposed on the first visit.
Step 3 is reduce and remove.
This is the first part of phase 1 of your treatment plan. We are looking to reduce and remove things that are creating negative inflammation. We are looking to reduce and remove symptoms, and we're looking to reduce and remove any pathogens or negative processes and cycles that are happening in the body that are leading to how you're experiencing your day-to-day life and ultimately why you're here in the first place.
This leads to step 4, which is restore, reset, and repair.
After we've reduced and removed these toxins or issues, inflammatory cycles, or pathogens, we have to restore, reset, and repair these tissues. How your brain's functioning, how your body's operating, how your muscles are moving, how your gut is digesting food, how your hormones are being produced. All of these wonderful things need to be restored and reset. Think of this as we just set the house fire out. Now we're looking to rebuild that house.
This leads to step 5, which is retrain and rewire.
This is arguably the best part. This is leading into phase 2, towards the end, possibly even phase 3 for a lot of patients. This is where we actually get to make those brain changes that last. Step 3 of reduce and remove, step 4 of restoring, resetting, and repairing absolutely last and have a lot of effect in the long term. However, when we retrain and we rewire the brain, this is that enhancing of neuroplasticity. This is your new normalcy in your nervous system. This is how we have not just symptom management, but long-term results that last years beyond leaving Axon as a whole.
And last but not least, we have step 6, which is perform and optimize.
This is where we keep up on maybe a quarterly basis, a couple times a year, maybe it's every month, but we make sure that we are optimizing and performing to the best of our abilities, making sure that our systems are feeling challenged in work and fueled in the right ways. This is how we move beyond just 100%. So these are our processes of being a patient. Clinically, we break this into phases. Phase 1, phase 2, phase 3. Currently, our eval and our discovery phase is steps 1 and 2 of our Axon process. Steps 3 and 4 of reduce, remove, as well as restore, reset, and repair are often combined into phase 1. Phase 2 often has a lot of the trail ends of step 4, which is restore, reset, and repair, as well as also moving into the retrain and rewire aspects. And then phase 3 is tying up the last little bits of retraining and rewiring and moving into performance and optimization. We phase these things out for you to be highly specific so that we can adapt and change based on as you progress, we can make things different and change those.
We have 5 BLGs, or basic lifestyle guidelines, here at Axon.
They are sleep, exercise, nutrition, breathwork, and community. How you sleep, your hygiene, the time, how much deep sleep you're getting, nutrition, and what you're eating, and the fuel that you're putting in for your brain and your body, your exercise, how you move your body, how you get blood flowing, how you challenge yourself, breathwork, how you fuel and recenter yourself, how you give your body oxygen, and community, who you spend your time with, your friends, your family, your peers, the people you love and adore.
These BLGs are so important and crucial in your improvements that you'll see here in the clinic. Here at Axon, we have a lot of different faces you'll be seeing throughout every step of your care. Between clinicians and admin staff, you have quite a few different people you'll be working with.
By having so many different clinicians and people involved in your care, you get multiple lenses and opportunities to have insights into your health through all of their different training and backgrounds and how they might see they can best help you. You don't always work with us. You may work with some of our CAs or the clinical assistants. You might work with some of our associates or PTs or some of our passive care specialists, our neurofeedback team, or our IV team. Whoever it is that you're working with knows your case. We all talk about your case, you as a person, your ups, your downs, your challenges throughout care on a weekly basis, sometimes even more. Communication and collaboration amongst our team here at Axon is highly important for us and is a core value to us. You having so many providers can sometimes feel overwhelming. If you want to just work with one individual person, whether that's one of us or an associate or one of our technicians, feel free to ask. It might change availability, things like that, but we have no problem with doing so. If you meld with a person more than somebody else, that's totally fine. We want to adapt and try to accommodate that the best we can.
If you do have specific questions and you need to reach out, then you can either call the clinic or you can email. In your welcome pack, there are specific emails for the providers, as well as the office for billing issues and the front desk for scheduling.
So everybody's email here ends at Axon Integrative Health. If you want to email one of your providers directly, it's their name at our email address. You can email info email for any direct clinical questions that will come back to us and your lead clinicians. You can email the front desk email for any scheduling inquiries, and you can email the office email for any billing updates or process questions. And throughout this process, it is a gentle reminder that we are your navigators. We are your coach. We are here to help guide and teach and educate and provide the best course of action. You, as the patient, operate as the captain of the ship. You are the ultimate decision maker and steerer of this ship. You want to make changes to the proposed treatment plan, you are more than welcome to ask and suggest those changes. We can hop on a call, we can discuss what those modifications might look like, the pros, the cons, how that might affect care. We can also make additions into other things that you might find interesting around Axon. We can either give you insight as to, hey, we can include this in this phase, it'll help in XYZ, or let's hold off into the next phase or the next phase of things so that it better fits, or you'll have a better efficiency and effectiveness through that therapy after addressing some other things. So we will absolutely educate around when or how to implement what you want to implement. If you want to set up a call with one of us or anybody in your care team to talk about care further, schedule what's called a clinical reasoning call or a follow-up consult to discuss further about your care, making any symptom changes, or if you had a negative experience or a really positive experience after a day and you want to either continue or change something because of such, you can let us know. You can always schedule calls. Consult calls are, think of this as more of a mini re-eval and a re-exam. They do have a cost associated. A clinical reasoning call is more so to educate around some of our decisions and why we've chose XYZ. That is free of charge. So being able to delineate between those two is something that front desk and admin staff can help you with. We can help you with. Just know that if you do have questions, you can always reach out to your team at any moment. Anybody that you have a concern or comment or an improvement mentioned, the entire team will likely hear about that before you even leave the clinic.
Thank you again for being a patient here at Axon Integrative Health, and congratulations on taking the next step in your healing journey.
Welcome to Axon